Hi, I'm VA-Accredited Claims Agent John Kent.
And I'm VA-Accredited Claims Agent Vittoria Marini.
And today we'll be talking about compensation and pension examinations. First off, regarding C&P exams, as they're often referred, why are they requested? The VA will often request these examinations, most often when a claim is filed for service connection purposes to determine the onset, cause, and or link nexus to service, as well as to diagnose a disability if warranted. For increased rating purposes, it's to determine the frequency and the severity of the disability.
Absolutely. As far as service connection exams, why would the VA decide to get an exam for service connection?
There's three elements to service connection. There's evidence of onset or injury occurrence in service, evidence of a currently diagnosed disability, and that nexus and or link to service. Essentially, the injury you had in service is the same disability that you have today.
Absolutely. And one of the most important things that the VA is trying to understand when you go through a C&P examination is how that disability that occurred or was caused by service has progressed throughout the years and is now that disability that a veteran might be dealing with today.
Yeah. And regarding increased rating examinations, what's generally the reason that VA will request an exam when there's an increased rating claim?
Well, when a veteran files an increased rating claim, that is because they don't feel that they're currently being compensated at the percentage that they feel is warranted. They go through a C&P examination because the VA wants to determine the current severity of that condition. And that might include different types of testing depending on the disabilities, which we can definitely discuss.
Absolutely. Now, regarding the mechanics of actually undergoing a C&P examination, once a claim has been filed and VA has determined that they want to assess either the onset nature of the condition or the severity of the condition, they'll look to schedule you for a C&P examination. Now, they'll look to either call you or potentially mail you to schedule an appointment at a VA facility or a third-party provider. Oftentimes, we see this through LHI or QTC. So if you do see a three-letter acronym reaching out to you, that definitely can still be a valid C&P exam request. The VA does try to match you up with the most qualified doctor, nurse practitioner in general to provide that examination for you. However, there are times when the examiner is not qualified to render that opinion, and you or your representative can argue against the validity and the qualifications of the individual completing that examination. Because when the VA requests an exam, they have a duty to provide an adequate one.
Absolutely. Absolutely. And like we said, these C&P examinations, depending on what they're for, whether it's service connection or increased rating claims, they can look different, and those experiences can be a little bit different depending on what your claim actually is. Like we said, service connection is going to try to look at the onset of the condition, how it's progressed until now. And it would be helpful as well in that instance, if you don't have a diagnosis already that's in your record, that examination might be able to provide you that diagnosis because it is a medical professional who should be qualified to render that opinion. For increased ratings, specifically if we were to talk about orthopedic conditions, like we said, we're trying to determine, the VA is trying to determine the severity of that disability and how that is right now, what that severity is at the moment, to determine your percentage. If we were to look at orthopedic disabilities, that might be different from mental disabilities. And oftentimes, for the most part, all of the testing that will be done for the increased rating exams will be objective findings like range of motion. But there are also some subjective elements in it where you can talk about your functional impact and you can talk about the effect that your disability might have on your activities of daily living. So if you would rate your pain 7 out of 10, that's something that you would be telling your examiner about how you're feeling. So you do have the opportunity to do that, even though the majority of it is objective testing.
Yeah, certainly. And that's a great point regarding orthopedic exams. There is a fair amount of objective findings, range of motion measurements, pain scale, but it does leave room open to subjective lifting, carrying, standing, walking, sitting. Now, when you are going for a mental health compensation pension examination, if it's for service connection, they're going to want to find the onset or the incident in service, whether it was manifesting in service or if there was an incident in service that later caused you to develop your mental health disability. They'll look for that nexus, treatment, potentially even a lack of treatment, i.e. self-medicating, compensating the best way that you can, even if that's not going to a VA healthcare facility for your mental health treatment. When it is an increased rating examination for your mental health, unlike orthopedic exams, they're a lot more subjective. You can talk about good days versus bad days. A lot of veterans, they unfortunately underreport their symptoms at C&P exams. They'll say things such as, I'm generally okay, I'm getting by, I'm making it through. This is the time to talk about the bad days, days where you can't bring yourself to get out of bed, days where you can't even shower, brush your teeth just because you don't have the will ability to do it that day. This is the time during these exams to talk about those bad days. As far as not just the bad days, talk about symptoms as a whole. Talk about how it affects your daily life, how it affects your relationships with others, avoiding crowds, not just friends and family, but coworkers in a workplace setting. A huge chunk of the PTSD criteria is based on occupational and social impairment. So that occupational impairment is a huge portion of it. If you do talk about fights with coworkers, difficulties with clients, bosses, taking demands and taking instruction from your boss, it's not always the easiest thing. So it's important to talk about those during those C&P examinations for your mental health.
Absolutely. And I think one question that we get a lot from our clients is whether during increased rating examinations for psychological disabilities, mental disorders, if they're going to have to talk about their stressor or whatever triggering event that was in service that led to their service connection. We won't say that you never will have to, but that is not the purpose of an increased rating exam. So chances are, if the examiner is sticking to the books and doing everything by the book, then they shouldn't ask you about that stressor, especially if it makes you uncomfortable. Some people might want to know about that. So the main thing is it's not the focus of the exam. It might come up, but it shouldn't be the main thing that's talked about. What's most important is trying to figure out what your current symptoms are and that you're as honest as possible about how things are going right now.
Absolutely. So once you've been scheduled for the C&P exam, it's a C&P exam for either your orthopedic disabilities or your mental health disabilities. Probably the most important thing is getting not just physically prepared, but mentally prepared. Understanding what's the purpose of the examination and how to best go in to that examination ready to accurately and effectively talk about your conditions and how they affect your daily life. A great piece of advice before going into this exam would be to gather your thoughts before you attend. Take some notes regarding your symptoms. Keep a journal. Bring a spouse, partner if you wish, because they can be a great resource. They can talk about things that you might overlook or you might forget. There's a lot that can come up during these exams, and if you have someone there with you that can be a resource and also talk about what they witnessed firsthand, they can absolutely be there with you and help you guide you through that process.
Definitely. And whether it's your first time or you've gone through a couple of them, sometimes you might forget some things that you would want to say. So having someone with you that you trust, that could be that second voice for you, might be helpful and might put you at ease a little bit. Another piece of advice that we would give is to just remind our clients and veterans that you are being watched, and the examination essentially starts the second that you pull up to the parking lot. You want to make sure that your behavior from the time that you get out of your car, go into the facility, your discussions with the receptionist and any other patients that might be in the waiting room, you're being mindful that you're being observed or that you could possibly be observed from that moment up until the time you leave and you get into your car. So the start point and the end point of the examination is at those periods. We don't want to any situations where a conversation that a client might have with another veteran might be overheard and misconstrued in any way.
Absolutely. That's a great point. Expect that your examination starts from the moment you pull into that parking lot to the moment that you leave that parking lot. Well, I hope that this has been an informative process. If you have questions, please don't hesitate to reach out to us at Green Maruzak, 844-483-8737. Thank you.